There are two kinds of tests used for COVID-19: viral tests and antibody tests. Viral tests are used to determine whether an individual currently has the coronavirus, while antibody tests are used to determine whether an individual has contracted the coronavirus at some point in the past, usually 2 to 3 weeks before the test is conducted. The viral test is carried out using a technique known as reverse transcription polymerase chain reaction, or RT-PCR for short. It determines whether an individual has COVID by testing throat and/or nasal swab samples collected from patients for the genetic material known as RNA, which is unique to the virus. Antibody tests, on the other hand, use blood samples to determine whether antibodies are present as a result of past exposure to the virus. Viral tests are used for diagnostic purposes, whereas antibody tests may be used to estimate the true rate of infection in a particular group, as they can tell if someone has been exposed to the virus without having developed noticeable symptoms. Knowing the true rate of infection is important because the confirmed cases metric is likely to substantially underestimate the rate of infection, as it only considers individuals who test positive for COVID-19 and does not count those who did not get tested as a result of having mild to no symptoms. Not all tests are created equal. In order to understand how effective a test is, one needs to understand the concepts of sensitivity and specificity. Sensitivity refers to the likelihood that a test returns positive when administered to an infected individual, whereas specificity refers to the likelihood that the test returns negative when administered to an individual that is not infected. In diagnostic tests such as RT-PCR, it makes sense that sensitivity should be prioritized over specificity, as the risks posed by a false negative outweigh those posed by a false positive. An individual who receives a false negative may go on to infect many others under the assumption that they are disease-free. On the other hand, as far as antibody testing goes, specificity must be prioritized over sensitivity, as the risks posed by false positives outweigh those posed by false negatives. An individual who receives a false positive may abandon caution under the incorrect assumption that they have immunity from the disease, while in reality, they are just as susceptible to it as anyone else. Read our blog, What You Need to Know About Getting Tested for COVID-19, to get a more in-depth analysis of COVID testing practices.